But isn't the whole cholesterol market a little bit shaky in a sense that the amount that's considered healthy or unhealthy continues to come down over the years? Right. And so every time you lower the acceptable amount of cholesterol level, you capture another 5 million people or whatever it is that have high cholesterol. But and the doctors that are on the board are all on the payrolls of the companies that make the cholesterol medications. Right. So it's like, just, why don't we just say 1 point cholesterol is now high?
CNBC's Brian Sullivan bringing a financial viewpoint to the whole medical question of cholesterol, discussing that trend of ever lowering acceptable cholesterol levels that result in new pharmaceuticals and an increase in pharmaceutical sales. But could taking the drugs actually cause more harm than they prevent? Let's discuss these potentially harmful practices with board-certified family physician Dr. David Brownstein, who is here at the anchor desk today. Dr. David, of course, a Newsmax insider. You can read all of his contributions at newsmaxhealth.com. Welcome back to America's Forum, David.
Thank you for having me, JD.
Let's get into this. Statin drugs. A lot of family physicians say you need them. Do we really need them to combat cholesterol?
They're the most profitable drugs in the history of Big Pharma right now, and they're being promoted in ever-increasing numbers. The problem is the best of the studies show a 1 to 3% reduction in heart attacks for those who take statins. Another way to look at that is 99 to 97% of people get no benefit from taking them. I don't think they should be the most prescribed drugs. In fact, I don't think they should be prescribed at all, since they fail the vast majority of people who take them.
So, David, mindful of that, if statins aren't really what they're promoted to be, what should people do then to combat cholesterol and for heart health?
Well, people need cholesterol. Every cell in our body needs cholesterol for optimal functioning. So I don't think we should be taking a drug that poisons an enzyme that is responsible for making cholesterol that every cell in our body needs. I think we need to get away from this focus on what our cholesterol number is, and the latest studies show that. The study out of Europe just proved that it doesn't really matter what our cholesterol levels are, and I think that we need to move away from that thought process.
So, mindful of that, you're saying we got to kind of free ourselves from the cholesterol trap, always concerned about those numbers. But is there a situation in your mind where someone needs to lower their, quote, bad cholesterol? And is there something that could be utilized in the medical or nutritional arsenal to help do that?
Well, the body raises and lowers cholesterol depending on what's going on in the body. So in a time of inflammation, which could be a heart attack, could be an infection, the body's natural response is to raise cholesterol levels to fight that infection. The worst thing you'd want to do in those situations is to chemically poison an enzyme that lowers cholesterol. That's why the outcomes are no good for people who take statin drugs.
Mindful of that, are there other problems with statins? I don't know if I've read or if I've been confused. Do statins potentially weaken the heart muscle?
Well, we might be able to say that a 1 to 3% reduction in heart attacks is a good thing if the drug didn't have any adverse effects and it was inexpensive. That's not the case with statins. Statins are associated with a host of adverse effects, including muscle disease and ALS and congestive heart failure and brain dysfunction, and those really should not be prescribed for anybody out there.
So, from your perspective, with your patients, you suggest a statin-free approach.
I haven't met a statin deficiency syndrome patient yet, and yes, I suggest my patients go off statins, and if cholesterol levels are elevated, the first thing that should be done is to figure out why they're elevated in the first place and to treat that.
We've got about 3 minutes left, and a little more than 3 minutes, and I want to switch gears. Measles back in the news. The number of cases of measles in the United States growing exponentially. There's intense debate about inoculations, vaccinations. In your mind, is the measles vaccine safe?
The measles vaccine is very effective at preventing the measles for most people who get it. However, it is not safe for everybody who gets it. And to have a universal vaccination mandated for every child out there, I think is the wrong way to go. I think we need to have choice for parents to decide if the vaccine is appropriate for their children.
But in terms of MMR, measles, mumps, rubella, even with some people having difficulties with that vaccination, Are we able to have, like we see in Marin County, California, is it responsible for parents to say, nope, I'm not going to have my kids vaccinated?
You know, JD, I've heard the same story over and over in my practice. The child was well until they received a vaccine, and then they started regressing emotionally, physically, and mentally. And for those parents, I think they have a little different opinion on what's going on. I don't think no one should get any vaccine, but I think vaccines need to be better studied. We need some more research on the safety of them, and parents need a choice.
You know, as a recovering member of Congress, I can't seem to get away from research in the public square, which comes in the form of polls. And there's a poll from the Pew Research Center that shows younger age groups are less likely to think childhood vaccination should be required. I guess this would include young parents, 25 to 45. And then as people get older, they're saying, hey, there should be vaccinations. Is that because of the generational differences, you think? We actually have the poll group numbers. Parents should decide vis-a-vis it should be required. There are the graphics right there.
I think it's very tough for parents out there. All parents want to take care of their children and make the best decisions for them. And when parents hear stories of children injured from vaccines, and there are stories out there, and I've seen them in my practice, I think it calls it into question whether we're giving too many vaccines at too quick of a rate for too young of children.
Got about a minute left now. Do you believe that one day there will be some sort of test for vaccine tolerance across these shots? Is something like that in the works?
You know, JD, we need to do the basic research on the safety of vaccines, which has never been done. They've never done a study comparing unvaccinated with vaccinated populations. We simply don't know how safe they are because the research hasn't been done. And until that occurs, we're just questioning the whole thing.
Dr. David Brownstein, you always raise questions that make us think, and we appreciate very much your perspective. A couple of points we've been talking about. For example, could it be that you're sabotaging your heart with statin drugs? You can learn more by going to newsmax.com/statin myth. That's what Dr. Brownstein talked about. And also, just what we were talking about here. Should parents have the freedom not to vaccinate their children? Why don't you get engaged in our online poll? And you can do that, newsmax.com/vaccine poll. Dr. David Brownstein, so good to have you make this, I guess we call it a studio call instead of a house call. Really
Thank you for having me.
Good to have you, Dr. David Brownstein. When we come back, my old congressional colleague, Bob Walker, really out there. We're going to talk about going to Mars. Right now, this news update.